Whiplash is most commonly caused by car accidents that result in a sudden exaggerated thrust of the head backwards, forwards, or sometimes sideways. There may be no visible bruises from this type of injury, but the abnormal forces applied to the tissues of the neck and spine can have prolonged effects. This most commonly involves injury to soft tissues, such as neck muscles and spinal ligaments. However, it can involve injury to the discs, vertebrae, and even the blood vessels, nerves, and spinal cord. It is important to seek prompt medical advice and assessment if you experience numbness, tingling, or pain in the arms, legs, hands, or feet, headaches, altered vision, or dizziness. If a mild ache or pain is felt straight away in the neck or shoulders, then it is likely there has been some overstrain or micro-tearing within the muscles. If at the time of the accident you felt fine, but the next day you woke up with pain and stiffness in the neck, then you are more likely to have damaged the ligaments or discs, or sustained bruising to the bone. Sometimes symptoms take a week or two to reach their peak, with the area becoming progressively stiffer. This often indicates healing taking place in the soft tissues, a time when scar tissue is being laid down. If symptoms do not settle within 4 to 6 weeks, there could be excessive scar tissue or fibrosis of the soft tissue that will need rehabilitation with exercises and manipulation from a qualified therapist experienced in treating whiplash. In terms of self-management for whiplash, the best advice during the first few days is to rest and remain as comfortable as possible without trying to stretch the injured area, as this could cause further damage and aggravate any muscle spasm. After a week or two, if the acute pain starts to settle, and once any muscle spasms have calmed down, heat packs and gentle stretches should help relax the tissues and facilitate healing. Make sure stretches are performed very slowly and held for at least 10 seconds with no bouncing or tugging. Less than 10 seconds could mean that the muscles tighten rather than relax. If you still experience problems after 3 to 4 weeks, and particularly if you feel muscular tension at the top of the shoulders, with a vague radiation of pain into the neck and head, be careful of having a massage from someone inexperienced with treating whiplash. Gentle styles of massage probably won't be deep enough to soften scar tissue and relax off tight portions of muscle. Equally, vigorous or fast-paced styles of massage will tend to aggravate the nerve endings within injured muscle and make the muscle tighter or send it into spasm. Whereas slow, firm, short massage strokes that are held for around 10 seconds will usually be best. You could try some self-acupressure techniques or get a partner or friend to try it. By placing your hand on the opposite shoulder around the trapezius muscle at the top of the shoulder blade, first feel for tight knots or bands of muscle that either reduce or increase any pressure in the head or neck as you press them. If you find these trigger spots, slowly apply firm sustained pressure for between 90 and 180 seconds. Keep the pressure static without any style of massage movement. If a friend or partner is applying the pressure, they could use their elbow. If you are doing this yourself, you could use the crooked handle of an old-fashioned walking stick or other products that are specifically designed for this task. This procedure is often sore at the time and may feel as though it is aggravating referred symptoms to the head and neck as the pressure is applied. However, it is important to sustain the pressure. After approximately 60 seconds, the pressure should feel as though it is easing. Once the pressure has stopped easing, or after 3 minutes, slowly release the pressure. The next day, the area is likely to feel tender and bruised. This could last for a few days, but once this has resolved, some relief in symptoms should be noticeable. The whole procedure can be repeated once any bruising from the first acupressure session has recovered, which usually equates to once or twice per week. If symptoms persist for 6 weeks or more, it would be wise to consult your doctor or therapist in order to seek treatment. The longer one puts off having treatment, the more chronic a problem is likely to become, and the harder it will be to resolve. In most cases, it would be wise to consult your doctor or therapist much sooner, within the first week or two,